Hiatal hernia is a condition where part of the stomach pushes up through the diaphragm into the chest cavity. The diaphragm normally has a small opening, the hiatus, through which the esophagus passes on its way to connect to the stomach. In a hiatal hernia, the stomach bulges up into this opening, which can lead to various symptoms and complications. There are two main types of hiatal hernias, sliding and paraesophageal. In a sliding hiatal hernia, the stomach and the section of the esophagus that joins the stomach slide up into the chest through the hiatus. This is the more common type. In a paraesophageal hernia, a part of the stomach pushes through the hiatus and lies next to the esophagus, which is less common but more concerning due to the risk of the stomach becoming strangled, cutting off its blood supply. The causes of hiatal hernias can include a combination of genetic predisposition and lifestyle factors. Increased pressure within the abdomen, such as from heavy lifting, persistent coughing, obesity, or pregnancy, can contribute to the development of a hiatal hernia. Additionally, aging and a weakened diaphragm can also increase the risk. Risk factors for developing a hiatal hernia include age, obesity, smoking, and certain genetic factors that may contribute to the weakening of the diaphragmatic muscle. Pregnancy can also increase the risk due to the increased pressure on the abdominal cavity. Symptoms of hiatal hernias vary depending on the type and severity. Common symptoms include heartburn, regurgitation of food or liquids into the mouth, backflow of stomach acid into the esophagus, acid reflux, difficulty swallowing, chest or abdominal pain, and shortness of breath. In severe cases, especially with paraesophageal hernias, symptoms might include severe chest pain, difficulty swallowing, and gastrointestinal bleeding, indicating a medical emergency. Treatment options for hiatal hernias depend on the severity of symptoms and the type of hernia. Lifestyle and dietary changes are often recommended to manage mild symptoms. These include eating smaller meals, avoiding foods and drinks that trigger reflux, such as spicy foods, chocolate, caffeine, and alcohol, quitting smoking, losing weight, and avoiding lying down immediately after meals. Medications like antacids, H2 receptor blockers, and proton pump inhibitors can help reduce stomach acid and manage symptoms of acid reflux and heartburn. Surgical management is considered when lifestyle changes and medications do not effectively control symptoms, or if complications such as strangulation of the stomach occur. The most common surgical procedure is a laparoscopic Nissen fundoplication. This minimally invasive surgery involves wrapping the upper part of the stomach around the lower esophagus to reinforce the lower esophageal sphincter, preventing acid reflux and repositioning the stomach within the abdominal cavity. Another procedure is the repair of the hiatus itself, where the hiatus is tightened to prevent the stomach from protruding. A comprehensive nursing care plan for patients with hiatal hernia focuses on education, symptom management, and postoperative care for those who undergo surgery. Nurses play a crucial role in teaching patients about lifestyle modifications to manage their condition, such as dietary changes, weight management, and smoking cessation. Monitoring for potential complications, such as strangulation or gastrointestinal bleeding, is essential. For patients undergoing surgery, preoperative care includes education about the procedure and what to expect, while postoperative care focuses on pain management, monitoring for complications, and promoting recovery through gradual reintroduction of diet and activity. Understanding hiatal hernia, its causes, risk factors, symptoms, treatment options, and the importance of a comprehensive care plan can significantly improve patient outcomes and quality of life. Effective management often involves a combination of lifestyle changes, medications, and in some cases, surgical intervention. Subscribe to us for more videos like this and visit bazaarbiblio.com for notes and free PDF books. Thank you.